systems. We are also working on projects that are dealing with sexual, reproductive, and maternal health. Then we also have different projects that are also looking at chronic diseases. And actually, one of the projects in DSI called Madiva is looking at multimorbidity. It's actually hosted in one of these units under the health and well-being. Then we also have other projects and teams working to strengthen health and health systems. We're also looking at education. Allow me not to delve into each of the units, but basically these are units with big teams of researchers and analysts and data scientists. Yeah, so there are quite a number of projects and collaborations that we are currently working on as an organization. And even today, it's also an opportunity to get more collaborators and to actually generate more evidence or rather interest in the research organization. So allow me to tell my colleague Bilha to take it over from here so that at least she can work and speak more about the data science program. Over to you. Thank you, Bilha.
Thank you, Dan. So I'm Bilha Mugotisa. I'm a data scientist under the data science programs of APHRC. I'm based in Kenya and I work in the mental health informatics section of data science. So we'll just go through what we currently do and then what we hope to get from researchers and then also what we hope to give as an organization. So under the data science platforms, we have various working groups across the organization. We have the Inspire group, that is a team of data scientists from Africa in collaboration with London School and other collaborators. We build common data models. We also work with cloud locations like AWS and such. We develop no-code platforms, and these codes are important because they help non-technical people to still be able to be part of analysis and result and findings. And so we also work with the data governance and sharing working group, which works in development of curriculums for anonymization, and also they are like our watchgate. They ensure that we are adhering to ethical approvals of data governance and sharing to promote open science. And then there's also a working group on fair data standardization. And our colleague previously mentioned during the previous discussions on findability, accessibility, interoperability, and reusability of data. And so this unit works to ensure that we harmonize internal APHRC data. Data is extensively found in APHRC repository. And then we also work with HDSS sites across Africa, selected HDSS sites, health demographic surveillance system sites that collect continuous data on different mental health, in different health conditions, including mental health, verbal autopsy, climate change, and such. And then we also develop African-led vocabularies and modify what is there for use across data harmonization, standardization, and analysis. And then also work to build capacity for data professionals on fair data principles and data standardization. Another working group is the Big Data and Analytics group that works under machine learning and artificial intelligence. And so there is my ML and AI supported projects in this working group. There is mathematical modeling that has extensive projects. Then there is dynamic and stochastic model that is also based in that. And so there are several projects that you work on under the working groups that we share different skills and expertise. And so most of the projects are spread across the different working groups. One of them is the Data Science Without Borders project that works to strengthen data systems in African health and research institutes. And it also provides a federated no-code platform for deploying machine learning models. Another project is the Mental Health Data Prize, where we build capacity of mental health practitioners and stakeholders across Africa and prepare them for development of a call from the funder, who is Wellcome Trust. We also have a project on building a data science platform for longitudinal mental health research in Africa. that is also from Wellcome Trust, and it works on building an open source accessible data science platform where we can update and be able to analyze mental health data using a federated model. There's the Lacuna project that works on modeling and prediction of effects of climate change on mortality in rural African communities across selected African countries. And you also have like the agent-based modeling that is funded by the Bill and Melinda Gates that works on building capacity of researchers across Africa and majorly East Africa, based in Nairobi, on agent-based modeling. So as much as we have different ways of harmonizing data, including reports that we get from DHS surveys, and this is across the low and middle income countries, there's need to constantly harmonize data so that we can use the data for wider analysis. And so there are different platforms that are used for harmonization of data. And in DSP, we have decided to use OMOP, which is Observational Medical Outcomes Partnership Database, which is a common data model that was developed by the ODSI group. And the reason for doing this, it's actually under one aim: to try and facilitate discoverability of data and maximize the uptake and use of that. Thank you. You are watching out on my time. Thank you. So this slide shows what data pipeline we use, whereby data starts with the data providers and the integration of the data at the local level. So then data providers are able to upload data into the OMOP Common Data Model, and OMOP Common Data Model can actually be owned and can be under control of the data providers in a federated model. So the CDM makes the data fit for Sentinels, and then we can use any data science and analysis program in which we are able to analyze data from multiple sites across the different HDSS sites that we collaborate with. And this enables us to provide a more detailed analysis of data and to justify reporting and results. And so we have developed some of the information through aggregate measures of statistics, which we are able to link the findings to United Nations Sustainable Development Goals and other MOH dashboards that are used. And all this is achieved through keeping the protection of individuals within the research studies environment. Yes, next slide. Yes, so what APHRC can offer to research partners across the diverse array of projects that we work on, and as my colleague had previously mentioned, is that we stand out as a robust hub for research in excellence and innovation, offering substantial resources and capabilities to enhance collaborative research. So we have extensive data science expertise in data harmonization, data verification, and use of ML and AI tools in mathematical modeling. And therefore, APHRC is able to contribute significantly to analytical power through joint research. We also have innovative solutions where we have partnerships that enable the incorporation of fresh perspectives and innovative methodologies into APHRC projects. And this helps us to drive forward the development of new solutions, especially in health systems research. There's also expanded data collection, where we are able to collaborate in new and existing opportunities of collecting new and existing data, which we are able to harmonize and upload to the various repositories across the organization. And this helps us to not just to be able to raise resources, but also to be able to improve the comprehensiveness of depth of research conducted in Africa. And all this is because we want to be able to strengthen the influence of research into policy in Africa, particularly in the realm of health policies and data governance. Next slide. What we would gain from the partnership and collaborations of such networking events would be enhanced research outputs, where we'll be able to collaborate externally and augment our research outputs, contributing to the wider body of knowledge. We'll also be able to develop data resources and which means that we'll be able to manage extensive data repositories, including longitudinal mental health data that you're working on in some of the projects that I mentioned. And these resources will be coupled with commitment to FAIR principles, findability, accessibility, interoperability, and usability, and ensuring that the data is shared with partners and various data users across Africa. In terms of infrastructure, we have robust research infrastructure, including development of no-code platforms. And this allows researchers to conduct sophisticated analysis without deep technical expertise. I had mentioned this before, and it is ideal for environments with limited access to data science resources. So as a data science department, you are able to work with non-technical people to see that you are able to conduct analysis across big data. And then under network, yes, this is the last slide, yeah. Under network and outreach, through our established networks in Africa, we're able to facilitate connections in a wide array of stakeholders, including funders, policymakers, academic institutions, and all that. And so together, these factors delineate mutually beneficial relationship between APHRC and any potential research partner. And this is underpinned by the shared goals of advancing research and achieving greater societal impact through data-driven insights and interventions. Thank you.
Thank you. Thank you so much, Bilha. Thank you for keeping time. I'm going to welcome Dennis from Arifa. Dennis, please feel free to share your slide. And for the rest of us, please feel free to post any questions that you'd like for the presenters. We'll give a bit of time after the presentations for everyone to ask questions. And I think Bilha's team can prepare for questions on OMOP and also the no-code platforms as well. Dennis, go ahead.
Thank you. Let me try to display my presentation. Just a minute. So, good afternoon, good evening, depending on where you are. I'm convinced that my presentation is seen. Can you please confirm if you can see my presentation?
Put it in presentation mode, please.
Okay, is it seen?
Not yet.
What about that?
Not yet. Probably stop sharing and try sharing again.
Okay. And how about that?
Yes, perfect. Thank you.
Okay, good evening, good afternoon to everyone, depending on where you are. My name is Dennis Muigusa. I'm working with African Research Institute for Artificial Intelligence, for AI. So we are basically, we are based in Dar es Salaam, Tanzania. And yeah, we do have a training center, which is also based in coastal region, another region of Tanzania. But also we have our head office in Dar es Salaam, Tanzania. So I'm going to talk a bit about our organization, which is the ARIFA, that is Africa Research Institute for AI, but also the services that we are currently offering pertaining to DSI Africa. But also I'm going to talk about what can ARIFA gain and from partnering with various researchers from this network. And also I'm going to conclude. So, well, today we are falling under research centers, but we are also a not-for-profit organization registered under Registrar of Civil Societies at the Ministry of Home Affairs. So our main objectives is first to monitor the international IT and AI, but we do also undertake technology assessment and forecast and analyze the impacts of new technologies for the purpose of providing policy options to Sub-Saharan African countries, but also fostering collaborative research and networking between researchers and experts from different parts of the continent. We are also conducting high-quality research. We do the policy analysis, capacity strengthening, and outreach on applications of AI policies to sustainable development in SSA. But also we are promoting and creating awareness in the adoption, transfer, use, and adaptation of IT and AI. So, well, the projects that we are working on currently, we have the social media data mining. This is a project that we are actually looking on the informations that are being shared through social media platforms, but which are related to health. So this means we generate data that can be used for public health surveillance, but also as health researchers, we saw there is an opportunity to easily and affordably gather these massive volumes of user-generated data from social media sites. So this amount of data requires an automated method for analyze to realize their maximum potential. So we use the data science methods, such as the data mining techniques for the analysis. So we conduct research aimed at extracting trending topics and themes towards various health issues, such as disease outbreak and vaccines. But also a case in point here is factors which are either positive or negative to influence the uptake of vaccines. But the sentiment analysis, we use the social media data to analyze the sentiments towards various health-related issues, such as policies and vaccines. But for the forecasting disease outbreak, we use social media posts to forecast prevalence rates of disease outbreaks. So the other project that we are working on, this is called AfyaLink. We realize that there is a very big problem in the sense of data interoperability in healthcare domain. And we understand that only people use 10% of wealth data, which is actually available. So with AfyaLink, now this is a typical Tanzanian healthcare domain. We are actually, this is a problem that we are facing, that we do not have open, accessible to sensible health data. But our system allows, what is currently in place, it allows only upward referral. There is no downward referral, but there is no data integration and sharing. So our system, the solution that we have, is based on decentralized architecture by providing an efficient means of bridging the gap among health institutions and the hospitals. So first is to bridge the communication gap between the health institutions. But secondly is to provide trust for medical personnel to access the patient's data, but also the personal health information and past medical records is owned by the person, but also providing the accessibility of reliable health data and statistics. So these are some of the product services. There is a sharing records, analytics, and referrals. Then here we allow upward and downward referrals for patients while visiting different hospitals. And we have the more features like the health tracker to monitor the daily personal health monitoring and tracking, but also the research portal here for the researchers to process information for health researchers to use and carry out the data mining. But also we have a platform for software developers to build the health products and integrate the EMRs. And this business model, what Arifa can offer to research partners, first of all, is for the clinicians and physicians who are interested in more automated and less labor-intensive routines processes, but also for the hospital operators who are trying to optimize their income for medical treatments, the interest in improved efficiency of healthcare delivery. But for payers, these include the insurers, the decision-making in which service to cover, so they can make decisions on which service needs to be covered through their insurance services. But also for medical researchers, in need of processed information, for medical and product providers, performance of their products, but for software developers who need to use API to develop some healthcare products. But for the patients who have interest in affordable yet high quality and broad coverage of healthcare services. So these are the things that research partners can benefit from our organization. But well, this platform, it has some of the benefits like connecting, integrating health institutions and providing a seamless yet secure data sharing network. But it is preventive and proactive healthcare system. It is installed, the hospital EMR system can join the network through APRs. There is no need to replace the original EMR systems, but also software developers building their products based on the AfyaLink itself. This one enables the natural growth to the platform and community. So yeah, it's a dashboard solution And what would RIFA like to gain from research partners? First of all, is to access the latest research technologies and infrastructure, helping from our partners to adapt and stay competitive, but also partnering helps us and our collaborators to stay at the forefront of rapid technological change, but also allowing us to gain access to research from academic and research institutions. The other thing is to gain the gap between AI experts, data scientists, teams and scientists, but also solving today's most pressing challenges and sharing expertise and resources. There's the other projects that we are working on. Sorry, just need to display another presentation. But anyway, it's not that necessary. I can just say it from the background. So, you welcome questions while I'm trying to explain something else apart from what I've already explained.
So Dennis, are you
Well,
still trying to find your presentation?
Yeah, but anyway, I can just speak it because I understand what we are doing, so there is no need to play it. I can talk of what the other thing that we are doing apart from what I've displayed. So yes, here we have our researchers. They are some of our researchers are investigating longitudinal effects of HIV and ventricular white matters. This is PWMH on microstructure integrity of white matter drugs, but free water flow and cognitive impairments using deep learning and statistical approach. But we're also working on, we have an innovative mobile application that uses cognitive, that is using cognitive behavioral therapy. This is CBT techniques to help users manage stress and anxiety. So the application uses various CBT techniques, such as cognitive restructuring, behavioral activation, and relaxation techniques. This is to help users identify and change negative through patterns and behavioral contributing to stress and anxiety. So the application uses the reinforcement learning, the RL, but also the natural language processing, NLP, to personalize the user experience and improve communication with the user. Yeah, so those are some of the projects that we are also working on with some of our researchers. So that being said, I thank you very much, and I welcome questions if there is any for me to respond. Thank you.
Great. Thank you, Dennis, and thank you, Bilha. Thank you for the wonderful presentations that you have given us with regards to how the work that you do and relevance to research. So I think I'll jump to the questions. I will start with one for Dennis. Dennis, how is ARIFA funded? Are there fees to work with the services offered by ARIFA?
Well, thank you. We have some organizations which are funding us. We are working with Strathmore University, Center for Intellectual Property and Information Technology, but we are also working with IDRC, and we have also PLASIDA as well, but also AID for Artificial Intelligence for Development, Anglophone African Lab. We're also working together, but we are also receiving some funding since we are working with the government, funding from the government. We are partnered with some of the government institutions. We are collaborating on working against the various projects. but also we are collaborating with some of the universities. So we are also receiving funding from the local universities to work together on whatever needs to be worked on. And yeah, we have also partnership with some of the professional associations because we are not only working in health-related domain, we are also working in other areas. We are just an AI research organization, so we are also working on other areas such as finance, agriculture, climate change and environment, policy, law, etc., etc. So we are working on all those various areas. That's why we are partnership with various professional associations. Thank you.
And so for people who'd like to work with you, so do you charge a fee?
Not really. What we do normally, if someone is interested to work with us, we just we keep in touch and you let us know what you think you can add to our organization and what you have. And if we have a project based on your CV that we think we can keep you engaged, then we'll definitely keep you engaged. But if you have something that you need to work through our organization, then we can simply come to us and tell us what you have, and then we can use our organization as a platform. And maybe you can also help to give you some of the team members to work with you, since we have a number of experts from different parts of the world who are working. So we have the full-time employees, researchers, but also we have the part-time researchers. We are working when we have a certain assignment that needs their engagement. Thank you.
Great. So participants would like to get in touch with you. So if you could please drop your contacts, any link to newsletters on the chat to really help people like Charles Nimmo and the rest of the team. And it's good to have that buy-in that not necessarily at a fee, but you can partner with our fellow researchers. So as you do that, I would like to ask about data harmonization. This question probably it will go to both teams, Dennis and Bilha. For Dennis, you've said like you do data harmonization, like it doesn't matter which EMR. So people code their information differently in the electronic medical records. So how do you harmonize that data considering different codes are used? Do you face any problems?
Well, so as I said from the beginning, that we have a partnership with some of the government agencies and the regulators. So they are helping us to, keep the data because for now we, as an organization, we are really not allowed to keep the data. So we have to have a partnership with a government-led institution so that it can help us in terms of keeping the data. Yeah, so yeah, that's how we work with. And if we need any kind of data, then we have to request directly from the institution that is keeping it for us. So it's not a problem since we have a partnership agreement on how to execute. Yeah.
Okay, although probably I was referring more to the technical bit. For example, you may have hospital A with EMR data, and they want their data to be integrated with the platform that you're building. For another hospital B, they're using different coding systems, and yet you want this data to be probably shown on one platform, aggregation of all the data, harmonizing all the data from different sources or databases. Do you face problems?
I think, could I go? I'm
Yes,
not sure.
please.
Okay. And I think that's why I mentioned about use of common data models, because now, like us, when we use OMOP, it standardizes the format and content of all the data. So standardization will involve converting the diverse data set that includes electronic health records, administrative claims registry, demographic data, and then it puts this into a common format using standardized vocabularies and coding systems. And you see now this enables interoperability such that researchers are able to query across various datasets without needing to convert or adjust the data format specific to each source.
So, Bilha, you talked about modification of African-led vocabularies. So, are you insinuating like the kind of vocabularies to come with the the Common Data models, they are African-centric, such that they can't work with the rest of the world? What do you mean by modification of African-led vocabularies?
Okay. Like when you build data science platforms for mental health, you realize that the tools we use for screening and diagnosing mental health tools, they're good tools, but they are from the first world country. And so it is hard to relate first world symptoms or activities that happen to someone to African activities or symptoms.
True.
And so we are really trying to develop African-led vocabulary such that there are symptoms and things that speak to us as Africans, but can still be interoperable to data from the first world.
So, so probably in connection to that, but let me add this question that Sumir has just asked on the chat. What happens to data that cannot map onto OMOP? For example, we are familiar with OMOP probably having the Patient Health Questionnaire 9, the PHQ-9 data. The way the questions are asked or captured in the OMOP database is very different from how other institutions probably within Africa would ask the same question. So what happens to data that you cannot map onto OMOP? You cannot map to already the structures that are already in OMOP.
So we are currently launching something called a hosting database. It's a database that hosts data that is not compliant with the OMOP standards or Athena compliant. This is data that maybe has been collected using vocabularies that are not there in LOINC or SNOMED or other Athena compliant standards. And so we are able to do this by providing a framework that is amendable to high computing techniques, and we call it a staging database. The staging database is able to conduct analysis, upload the data, you're able to develop your own common or local vocabularies that you use, and these vocabularies are not in OMOP, and so you still have to do collaborations with ODSI team to ensure that your vocabularies are uploaded, but meanwhile you're able to use the staging database because it allows you to develop your local vocabularies.
Okay, so which means you just house the data without necessarily integration with the rest of the OMOP structure. Okay. So for there is a question by
It's not
Bebe. Oh, sorry, Bilha. We lost you, Bilha. Please go ahead.
Yeah, go ahead.
So
Okay. I was saying that we are able to host the data in the staging database that is
yeah.
Athena compliant, and then we work on developing local vocabularies to help push it to OMOP.
Okay, yeah, I think that would be great because one or the other, even if one research study has a way of probably asking the questions for PHQ-9, you one or the other, you'll have other studies that map the same kind of questions. So I think that's a really good initiative. There is a question, probably Dennis, you can first answer this, then we'll hear what Bill has to say about the same. How do you manage big data? Do you use Hadoop or other platforms, Dennis?
Okay, thank you. How do we manage the big data? So, first of all, we embrace the tools for enabling the data discovery, the preparation and self-data accessibility. But using the collaborative semantic metadata management, we have there are some of the high-performing computing centers in the country. We have one at Nelson Mandela, African Institution of Science and Technology, and the other, the Dar es Salaam Institute of Technology. So these are the academic institutions that we have also partnered with them in that matter. So that we are actually working with them in order to manage the big data. So they are the ones who are actually working on installing the data that we are having.
Collecting. Okay. All right. I guess that's the reason why we are all here as well, to find partners that can do that as well. So, Bilha, do you have another answer to that? How you do it as well?
How we work on big data, as I said, it's probably just to use data science programs and then to also work on no-code platforms where we work at the back end and then provide results that are open source. So you're able to access that as an open source platform.
Okay. Okay, cool. Bilha, I have one more question for you. Can you please expand on the data sharing goals of the Inspire network? Is there any plan to make the HDSS data being harmonized more accessible to researchers in Africa?
Well, yes, actually, basically what we work on is to try and reduce barriers to data sharing and integration in Africa. And it is major. There's so many barriers to data sharing. Like data
Yeah.
is there, but we keep on collecting new data across Africa locations. And so we are trying to enhance collaborative opportunities and the pooling of data together for more sustainable studies and research. So what happens as an Inspire network member, because it's a member of data scientists across different ages, the retirees to the ones that are just joining the network across globe. And so we collaborate with various HDSS sites. We have meetings across different countries quarterly to bring on board different HDSS sites to build their capacity on data harmonization, build their capacity on extract, transform, and loading data to common data models and such. And so, yes, we have continuous plans of working with HDSS sites to harmonize data and make the data public.
Yeah. Okay. Cool. So, and thank you so much, Bilha, and your team for leading these efforts from an Africa perspective. So, Cynthia, you seem to have a lot of really good ideas on the chat. So it's like you're advocating for something else. Please feel free to share with us.
Oh, no, I was just going to answer the question about or Hadoop. So I just wanted to explain that when you transform your data to the OMOP Common Data Model, you don't have to upload it to any central data server. You retain full control over your data. And the way that people collaborate is by sharing computer codes. So I think that makes it a little bit more tractable. Like you don't have to have a big server to host big data. Anyway, I have a lot of answers in the chat for people who want to know more about Odyssey and OMOP. Thank you. Over.
Okay. Cynthia, have you actually, what is the spelling of Odyssey and OMOP? I don't think I can see that on the chat. Could you
okay,
please put
it's oh yes.
Yeah, put it on the chat so that some of us who are interested in that can. Oh, that's what you mean. HDSI. Sorry, I had seen that.
We say it Odyssey. Yeah, and welcome people to join. It's free, and then we have a Odyssey Africa chapter, which is meeting every other week on Monday at 4 p.m. South Africa time. The next one is April 29th. And Inspire will be presenting more about their work there. Thank you. Over.
Great. Thank you so much, Cynthia. Bilha, there's something interesting that you have mentioned about your organization in terms of having a no-code platform. How does that work? I mean, especially when, as most of us look at open data science, trying to struggle with GitHub, but this one looks really interesting. What do you mean by a no-code platform, and how will that work for especially people who are not proficient or have any interest in programming?
Oh, yes. Yeah. So this came up when you were working majorly on mental health because we had to present results to the technical team, the ODSI people, Cynthia and the rest. And then we had psychiatrists who want to know about mental health. And we're like, and whenever we said the codes and the platforms, and they're like, what are you saying? And so we had to think of a way that we can be able to reach out to both groups, to target population, but able to meet their needs. And so through funding from IDEA is an organization based in the US, they're able to fund us to be able to develop a no-code platform where data science work and on your data, and you're able to click on different aspects that you need, especially on statistical analysis, types of graphs and the rest. You select the data, tick on boxes, and it gives you the output. And it's like it's working for people who are non-technical, because not everybody wants to get to the coding side of things, of results.
Bilha, probably in the next NetPractic exchange that we carry out, we'll encourage you to probably do a practical presentation on that. It's a bit hard to envision what you're talking about, although I think we understand, but it would be really good to have a practical orientation on what you mean by checking boxes. How do you access data without necessarily coding? Please consider that. So I have a question for Dennis. Dennis, you talked about forecasting, like using social media to forecast outbreaks. But then again, when you presented about the kind of projects that you're already working on, like you mentioned something about cognitive behavior therapy and how you use data that you've already collected and using AI to actually give personalized feedback in the form of therapeutic, like cognitive behavior therapy. How does that work? Because I think probably people are more familiar with taking forecasting data to create feedback of our population, but this time you're talking about creating feedback for individuals, because CBT is more individualized. So could you please give us more information on how you're able to do that in your project?
Thanks, Lecho. My colleague, Professor Benedicto, I'm not sure if his webinar is actually the project and is an expert in that area. Personally, I'm an AI specialist, but related to finance. So if he's around, please, he will respond to that. Benedict.
Yes, I'm around actually. I don't know if you can hear me.
Yes, we can. Thank you.
Okay. Can you please repeat the question?
Okay, it's like we have only 1 minute. So I think what we'll do, Benedict, you can share your information, contact information on how we can reach you for people who are interested in using AI platforms to create individualized feedback. Would really like to know that because most of the time we use AI for population-based decision making, but you're talking about individualized feedback. So please share your contacts on the chat. And also, at least Dennis has shared, Bill has as well. Please share your contacts on the chat for anyone who would like to reach out to you. So thank you so much, team, for coming for this particular session. It has been interesting moderating you. And yeah, please let's continue networking and supporting the Partnerships and Outreach Working Group. It's free for everyone. So I've shared the link on the chat, so please free to connect with us and let's come up with ideas.